Anatomy 32, Chapter 11, the muscular system. Topics, muscles of facial expressions and moving the eyes. So we will now be talking about the muscles along the axial skeleton, so the muscles of the head, neck, and trunk of the body. Start off with muscles that relate to facial expressions. So first up is occipitofrontalis. Occipitofrontalis, as you can see, covers the entire top of the head, going from the occipital bone all the way across to the frontal bone, and it inserts into the skin above the eyebrows. And so this makes this one of those muscles that inserts into skin rather than bone, and we see this frequently with the muscles for facial expressions. Also special about occipital frontalis is that it has two bellies, and in the middle an epicranial aponeuroses. So epicranial aponeuroses, again, an aponeuroses is a sheet of connective tissue, in this case connecting the two bellies of this muscle. And what does it do? Well, it helps to raise the eyebrows. So when you contract this muscle, you will raise your eyebrows, wrinkle your forehead. Then we have this deep muscle, the buccinator. Hard to see. It's on the lateral sides of the oral cavity. And it also inserts into the skin toward the lips, and it compresses the sides of the cheeks. For instance, you might do this when you whistle. It is also useful in helping to hold food in your mouth and move the food around a little bit when chewing. Then we have orbicularis oculi and orbicularis oris. So there's two orbicularis oculi, one going around each orbit, and then one orbicularis oris going around the mouth. These are circular muscles. They insert into themselves. And what do? Well, orbicularis oculi will allow you to blink or close your eyes, while orbicularis oris will allow you to close your mouth, and if you contract it strongly enough, even get sort of a kissy face. Because, of course, being able to open and close the mouth is useful during speech. All right, then we have zygomaticus major. Zygomaticus major going from the zygomatic bone to the upper corner of the mouth, and then depressor anguli oris going from the mandible to the lower corner of the mouth. These are both, of course, inserting into skin. And depressor anguli oris, when you contract that, will lead to a frown, will pull the corners of your mouth down. Zygomaticus major, when you contract this muscle, will help to pull the corners of your mouth up for a smile. Then we have levator labii superioris on the right and left sides of the nose. They insert into the upper lip, hence superioris, labii superioris. And as the word levator would make you expect, it elevates or raises the upper lip. So the name gives it all away. Labii for lips, superioris for upper, and levator for raises. So it helps to raise up the upper lip. And this also is important for speech. Then we have depressor labii inferioris. I wonder what that muscle is going to do. Well, as expected, it is going to be inserting into the lower lip. And then we also have mentalis. Mentalis muscle is right on the point of the chin. And they both are inserting into skin. Depressor labii inferioris, as you would expect, helps to lower or depress the lower lip, so pulls down the lower lip, important for speech. And mentalis, when it contracts, actually elevates and protrudes the lower lip, so it helps to stick out your lower lip like a toddler might make when they're giving you a pouty face. Then we have this thin sheet muscle, very superficial. It goes from the shoulder up to the face, and this is also inserting into skin. This muscle is called platysma. It's flat. This is a very flat muscle, and when it contracts, it helps to pull inferiorly on the lower lip, and also can lead to these tension of the skin of the neck. So tension pulling out of the skin of the neck, and also pulling down on the lower lip. Good old platysma. And then we have the muscles of the eye. There are 6 muscles that move the eye. There are the 4 rectus muscles, medial rectus muscle, which superior rectus muscle, inferior rectus muscle, and lateral rectus muscle. All of the rectus muscles have their origins in a connective tissue ring in the back of the orbit, and they all insert toward the front of the eye. And when these muscles contract, they move the eye basically in the direction that they are found. So medial rectus muscle moves the eye medially. Superior rectus muscle moves the eye superiorly and a little bit medially. Inferior rectus muscle moves the eye inferiorly and a little bit medially, and the lateral rectus muscle moves the eye laterally. Then we have the 2 oblique muscles. We have the superior oblique, which also inserts in that cartilage structure in the back of the orbit. Its origin is in that cartilage structure in the back of the orbit. It goes to the top of the eye, then makes a U-turn and inserts toward the back of the eyeball. That's why it's oblique, because this is at an angle. So superior oblique. And then the inferior oblique muscle, its origin is toward the front of the orbit and it inserts toward the back of the eyeball. And the obliques move the eye in the opposite direction from which they're located. So the superior oblique, when it contracts, moves the eye inferiorly and a little bit laterally. The inferior oblique muscle, when it contracts, moves the eye superiorly and a little bit laterally. So again, the rectus muscles moves the eye in the direction of the muscle. The obliques move the eye in the opposite of the direction of the muscles. And again, here's a view. Here is that cartilaginous structure in the back of the eyeball that 5 of the muscles have as their origin. There's the superior oblique. And then down here, of course, is the inferior oblique, whose origin is on the orbit of the eye. And that was it for this part of the chapter 11.